So we are looking at copper-based intrauterine device use and necessary upgrades for improved patient experience.
Copper-based intrauterine devices, or IUDs, generally work by slowly releaching copper ions into the uterus to create a hostile environment for egg fertilization and implantation. There are 7.43 million women in the United States who use IUDs as their primary method of contraception, and 6 to 13% of American women between the ages of 15 and 39 use IUDs. The United States has fewer IUD choices than the rest of the world, Europe especially, when it comes to copper versus hormonal IUDs. But the US markets for IUDs are estimated to increase by about 800 million by the year 2023.
Despite this, only 40% of clinicians currently suggest IUDs as a contraceptive device for their patients. There are three primary reasons to this, the first being a 6-fold increase in the risk of implant infection. The next is that 67% of users report increased cramps, bleeding, and spotting due to the uncontrolled copper elution of the device. The final is that 2.2 out of every 1,000 users experience uterine perforation. The clinical needs for the copper IUD to become more commercially used in the United States are antimicrobial properties, a more controlled copper elution rate, and fewer cases of uterine perforation.
We use the Paragard as the baseline for our approach. The Paragard dimensions and materials can be referenced in Figure 1. One of our goals is to control the release of oxidized copper. Our device uses a silver frame wrapped in copper wiring, and we will manipulate the properties of galvanic corrosion to release at roughly 70 micrograms a day, ideally sustained for 5 years. Similar corroding IUDs, which use a relatively more anodic nitinol frame as compared to copper, have an estimated copper surface area of 300 square millimeters with similar sustained release rates. But because silver is more cathodic than copper, we could hypothetically decrease the copper surface area to about 200 square millimeters. We also take into account the pain surrounding implantation due to the initial spike in copper released, usually around 200 micrograms a day for the first 100 days. The copper wiring on our device will be coated in a non-steroidal anti-inflammatory drug, for example ibuprofen, set to release as a first-order reaction during the first 3 months post-implantation. A study from 2016 shows the success of such cupric-bound drugs in rodent and rat models and suggests 3 milligrams of drug per patient kilogram. Furthermore, our material choices are both antimicrobial. Silver is shown to be resistant to select gram-positive bacteria. We will use less than 1 gram of sterling silver, and the metal frame must have a tensile strength of 13 megapascals and Young's modulus at or above 133 megapascals to prevent rupture from intrauterine compressive forces.
So the benefits that our device would provide are antimicrobial properties, controlled inflammation due to a more controlled copper elution rate, and rounded edges and inverted pear shape to create fewer cases of uterine perforation. On the flip side, our device would last for only 5 years as opposed to 10 for other IUD devices, and may have difficulty in implantation and removal, as well as being potentially more expensive.
So there are many products currently on the market for different types of IUDs. One common design is a polyethylene frame with copper wrapped around it. Two good examples of this are the Paragard IUD and the IUB ballerine as seen in Figure 3. The IUB ballerine is composed of this polyethylene frame with 2 entwined circles that have balls of copper dispersed along the frame. The ballerine also comprises about 300 square millimeters of copper, while our device needs only 200 square millimeters in surface area to have the same effectiveness. This decrease in the surface area of copper means that less copper is needed for manufacturing, and women who suffer from anemia and other conditions are able to use the IUD without fear of significant blood loss. Silverine and Nova-T utilize another type of design with a silver core with copper surrounding it. Both Silverine and Nova-T are T-shaped IUDs, which could be a significant source of pain upon implantation. With our rounded edges and pear shape that closely mimics that shape of the uterus, the rate of inflammation and possibility of perforation is greatly decreased. While there are devices that attempt to address parts of these existing problems, no device yet exists that deals with both inflammation due to copper release as well as pain and uterine wall perforation. Because of this, we see an opportunity to create an intrauterine device that can be used as an effective contraceptive while removing the existing pain and side effects that are associated with products currently available.